So for a pediatric patient assessment, of course, you're going to start from the top of your scene size up. You're going to walk in, or beforehand, you're going to want to make sure you're going to see your number of patients, MOI, NOI, don't need any additional resources or C-spine. If it's trauma related, you're going to want to use C-spine, have precautions ready on hand, and whatnot. If the scene is safe, we're saying we have one patient, we have an unknown MOI, NOI, so you'd walk in. Whenever we walk in, we're going to form our general impression. How is my patient presenting? Are they conscious, unconscious? Are they crying? Are they quiet? Is the baby limp or not? And whatnot. From there, I'm going to want to make sure if I have any bystanders on hand, if they know what happens, ask them any relevant questions, just so that way I can get a general idea of like what I'm walking into if I don't have anything prior. And from there, your ABCs. So you're going for their airway. Are they crying or not crying? Do they have a decreased response to their environment? Are they floppy or not moving at all? Like, normally whenever a kid's in distress, it's a good thing to hear them cry or speak, or they respond to those around them, and they'll have good muscle tone. They'll move if you try to grab them and whatnot. If that's all good, you'll move down to your work of breathing. So, are they breathing quicker? Are they flaring their nose? Are they using their abdominal muscles? Are they just not breathing at all? Or is there noisy breathing? Or is there wheezing, bronchi or stride or anything like that? That lets you know that there's something in there, whatnot. You have to get that fixed. After that, then it's circulation. So next you're going to move on. Do they have cyanosis? Any modeling? For their pulse, is it rapid, thready, bounding, weak, fast, slow, whatnot? For kids, depending on their background and what illnesses they have, their skin color could be a little different depending on the situation. But if it's anything like, of course, like they're pale, they're blue, purple, whatnot, then it's like, okay, this is a serious problem. So after that, then you would go down to your chief complaint of what has been either the child speaking up for it, or if it's the parent saying what happened, like they started choking or whatnot. To get a general level of consciousness for the kid, you can do AVPU. Do they respond to, are they alert to whenever you're verbal? Are they alert to whenever you have a pain stimulus? Or are they unresponsive in general? Or do they track you as soon as you walk in? If they're breathing, if they have any presence of stridor, wheezing, grunting, gasping, gurgling, their respiratory rates outside of the normal range for their age, central cyanosis, meaning that if their core is blue and pale, it's a big problem. You're going to want to get that. You're going to want to continue through that. For the circulation, you're going to check their pulse and strength. You're going to want to check how their skin looks, the temperature of their skin, cap refill, blood pressure, whole 9 yards. If they're cyanotic, there's modeling, they're pale, they have absent or weak pulses, or central pulses, which is a lot worse, or their blood pressure is outside of their normal range, cap refill greater than 2. That means it's abnormal for them. If there's any abnormal findings, it's going to be an ALS call, and if it's no ALS is available, get an intercept. Open their airway, give them O2. Depending on their age, it could be blow-by, goes up, use a cannula, non-breather, and then if they're in respiratory arrest or they're not breathing adequately for themselves, then you would use a BVM. If there's any excessive bleeding, of course, you're going to want to control that first. Doesn't matter if you have an airway, if they're bleeding out on you. You're going to want to check for reversible causes for their situation, whether they have diabetes, poisoning, history of seizures, If it's trauma related, what happened, when did it happen, how did it happen, and whatnot. You want to get a detailed history. If possible, you're gonna want to ask the kid what they're feeling. But if the kid's not able to speak, like for the pain scale, you could use the faces to assess like where they are in the pain scale. If they're visibly crying and screaming, it'd be a 10. Where if they just kind of are frowning, it'd be like a 3 or 4 on the pain scale. But have the kid speak about what they're feeling, and then if they're not able to speak, have the mom, the dad, or whatever bystander was on hand watching everything happen, whether that they started breaking out in hives, had trouble breathing, if they were playing outside and they went to go grab the ball and they got hit by a car. When did it happen? How long ago did it happen? Does anything make them feel better or worse? What are they feeling? What does it feel like? If they have pain, does it radiate anywhere, or does it just stay in the same spot? On a scale of 1 to 10, how's their pain? If an exact time is possible to get from the patient, that would also